Let's talk Coachella Valley.
I'm Conrad Negron with Tina Marks, your host for a fun show.
Informative show.
We're going to entertain, explore the Coachella Valley.
Give people a lot of knowledge, a lot of things that you have not heard about. We're going to bring it to you here. And we're back again for another amazing segment with Dr. Malcolm Lesavoy. Welcome back. It's always so good to see you. Today we're going to be talking about breast augmentation and tummy tucks.
Okay.
And as we get older, I've always been this way. But let's talk about breast augmentation first, okay? I actually was diagnosed with breast cancer over 4 years ago. I'm cancer-free 4 years now.
Great,
and
congratulations.
Thank you. They had a very difficult time finding I did a mammogram, it came back inconclusive. They finally found it with an ultrasound, okay?
Yep.
And I understand that when you have implants, is it more difficult to detect, or I have very dense breasts, so that's one of the reasons they had a problem diagnosing and detecting it for me. So
the answer is no. To answer your question, is it more difficult to detect breast cancer if a person has breast implants? The reason being that depending on where the implant is, either maybe we can start at the beginning, and essentially what a breast augmentation is to take a silicone bag like a balloon or a saline bag, a balloon, and insert it behind the breast so that the breast has more projection. Some surgeons put the balloon or the implant behind the muscle, which is behind the breast, which also produces more projection of the breast, and some, which I prefer, to put it in front of the muscle, in between the breast and
is that a more natural look? Is that the one that's
in my opinion, it is.
It is. So that's in between the muscle and the breast.
That's correct. It's just
as opposed
right behind
the muscle. Okay.
Exactly.
So the ones behind the muscle, is that the ones that really?
Well, to my opinion, they don't look quite natural.
Right.
But to answer your question about mammograms and breast cancer, which is very important.
Yes.
That is that does the implant implying if one has an implant, does that impede the detection of breast cancer? The answer is no. Because with a mammogram or an ultrasound or even an MRI now, there are many radiologists doing MRIs of the breast, which is even more precise. Essentially, the implant can be moved away.
Oh, interesting.
Very easily.
Just kind of pushed aside?
Pushed aside, and it's called the Eglin maneuver, which all radiologists know about. But basically what the breast augmentation is essentially if I'm putting my hand behind my shirt and I'm just pushing the shirt forward. Now, it's not that much. Right. But basically it doesn't change the shape of the pocket, the color of the shirt, or anything of that sort. It just augments the profile of the breast. The key is that it has to look natural.
Right, exactly. And there's all different shapes. There's ones that are more teardrop, correct? And
yes.
So you have all different kind of choices. And do you think that most people go too large for their body type, or do you think that?
Yes, in my opinion, that is the case. Essentially, the surgery itself can be done through three different approaches: through an incision in the crease under the breast,
okay,
an incision around the areola, the pigmented part around the nipple, or in the armpit. I do it through the armpit.
Oh, you do? Okay.
And so that essentially there's no scar.
There's no scar.
It's right in that area where women shave. Mm-hmm. And I tell patients, because the usual question that they always ask is, well, how big am I going to be? If I'm an A cup now, will I be a D? No, you will not be a D, because you can't put a size 5 foot into a size 4 shoe. You know, it just doesn't compute. And so I tell patients that it's really up to me. What you're paying for is my judgment.
Yes.
At the time of surgery, we have all different sizes, put different sizes in and out, until I find the largest size that looks natural. And the key is, I tell patients that if you're walking down the beach in Malibu and you have a very nice bikini on, and somebody says, oh, she's had her breast done, that defeats the purpose.
Yes.
In my opinion.
Yes, I agree. As with any plastic surgery, you just want you want to look
That's exactly right.
rested.
Yes.
The whole key is
there are some women that say, look, I want to have huge breasts because for me that's what I want, and
But that's going to cause like back problems and all kinds of problems, correct?
Well, I think so, and I just don't want to be associated with somebody that says,
that's
oh,
your
Dr.
work.
Lesavoy did those? Oh, that's terrible.
So you will turn people down.
Many times.
And you know what? I really respect
Many
that
times.
because I think there's some doctors that'll just do whatever they ask as long as they write that check.
Exactly.
Okay.
Exactly.
So is it a fairly safe procedure?
It's in my opinion, it's very safe.
It's very safe.
Next year, it'll be 40 years that I've been doing breast augmentation. I've written the definitive chapter in the Bible of plastic surgery, this 8-volume thing about plastic surgery. They asked me to write it about breast augmentation. It works out very well. It takes less than an hour as an outpatient. You do need to have general anesthesia.
Yes.
And you're recovered. You can drive in 2 days, start lower body workouts in a week or 2 weeks, and upper body in 3 or 4 weeks.
And one last question about breast augmentation. Do they have to be replaced?
Yes and no. The FDA now says that after 10 years, it's appropriate to have the implants replaced. However, I feel that it's really that the implant companies want to sell more implants. I tell my patients,
just like everything else.
Exactly.
If it's
I tell my patients, if it ain't broke, don't fix it.
Oh, okay.
You have your mammograms on an annual or every 2 years basis. If the implant isn't broken, which it could happen, but it stays right within the confines of that area, it doesn't harm the breast, there's no illness to your body or anything of that sort, then there's no reason to replace them. I've seen patients who've had implants for 30 years, 35, 40 years.
And there's no problem, especially if it's done correctly.
Well, if it's done correctly, but like anything, I mean, you buy a tire for your car, it can go flat.
Yes.
And that is possible,
Right.
and we do see that with saline implants. We don't see it that much with silicone implants. The key is that the implant is behind the breast, pushes the breast forward, doesn't cause disease or problems in any way. It doesn't cause or impede the detection of breast cancer. If you're going to have babies and you want to breastfeed, there's no problem with that either.
See, that's a fallacy. I heard that it did interfere with that. It does not.
It's my hand behind my. I'm not changing the pocket.
It's right, exactly. Okay, so I'm glad that we cleared that up. Yeah. Let's move into tummy tucks, which a lot of women, especially that have had a lot of. I was blessed because I didn't put on that much weight. And I only had one child, but once you've had that second and third, tell us a little bit about tummy tucks.
Tummy tucks or abdominoplasty essentially is when we have sagging skin of the abdomen, either from pregnancy, which is a wonderful thing, or a lot of weight loss or weight gain for that matter. This is not a weight reduction procedure at all. It's a contouring procedure.
Okay.
But with childbirth, frequently we have these muscles called the rectus abdominis muscles, 2 strips of muscles that come down here where you have your six-pack. I can show you my six-pack, but we're on TV, so you maybe not want to see it.
I saw it when you were dressing.
Okay. But the point is that those muscles start to separate, and so when we're doing an abdominoplasty, we like to tighten them so that the muscles are tight. And then essentially this extra skin that patients have, we essentially lift up almost all the way to the rib cage and then bring all the way down and remove the extra skin.
Okay.
The one negative thing is that you have a scar from hip to hip all the way along. And
all the way?
All the way along, exactly. And it's just above the pubic area or sometimes just below the pubic hair area.
Okay.
And a little scar around the belly button, because as we lift the skin, we have to leave the belly button on the abdomen. So there's a hole there where we've lifted this up. And then as we bring everything down, we cut off the extra skin and we make another hole for where the belly button comes through. We don't make a new belly button. It's your same belly button.
Right.
Just coming into a different position.
Okay.
Yeah.
Is there any way, can you work out and gain that back if you have extra skin?
Okay. Well,
or is it
good
surgically
question.
required?
Once that extra skin is removed, you can never get it back because it's in a bucket.
No, I'm saying if somebody's trying to debate whether to have it, yeah.
I understand what you're saying.
Yeah.
The point is that can you go and have babies? Can you, after an abdominoplasty, can you have babies?
You wouldn't be able to have babies then.
Well, you could. You could. You can.
Okay.
As a matter of fact, you can. As a matter of fact, I did my own daughter. I did a tummy tuck on her, and then she had a baby about 2 years later.
She appreciates you telling her.
Well,
Everybody knows now.
it's okay. But the point is that you can.
Okay.
I mean, it's maybe not as easy because you are snugger.
Okay.
But you can work out. If you're going to gain weight, you're going to gain weight. It's not like it's a magic potion.
Right.
It's just a contouring at that time.
Exactly. Now, you do not perform these surgeries down here in the desert, but you do perform them in your Encino office and your Beverly Hills office, and we're going to put all that information up on the screen.
That's correct.
You are here on Fridays to do facelifts and fillers, but primarily facelifts. And
That's right.
our
And
next segment, we're going to be talking all about facelifts.
Yeah, but there are excellent plastic surgeons here in the valley, in
Not like
Palm
you.
Springs,
Not like you.
who do breast augmentation and abdominoplasties. Excellent ones.
we
Just
know
make
that.
sure that they're board certified.
Okay, perfect. Thank you.
Okay.